What's up, guys, and welcome back to the podcast. My name is Robbie Cassidy, and today we're going to discuss managing golfer's elbow. So golfer's elbow is obviously a very common one that happens in a lot of sports, and you'd be surprised. Obviously, it's most renowned for golf, or I wouldn't be given that name. But it also, you'll find it commonly with throwing sports. You'll find it with any type of gripping sports, whether that is like if you're doing jiu-jitsu or wrestling, things like that will cause you to work that tendon, or any type of, I guess, throwing, gripping, swinging. The other one then as well is you can get it in sports that you have to eccentrically load that hand. So you'll get it with, if like, let's say in rugby, where you have to push someone back, and if you do that repeatedly, that will cause, because of the eccentric action, eccentric motion, where your body is trying to control it and it's not just slinging back into place, that will cause that area to get repetitive trauma, and then in time can kick up. So I'm going to talk through it. It should be a short enough podcast. Talk through some things that I guess, difference between golfers and tennis elbow. What is it like and why does it happen? And then after that, then how can you improve it? And this is off the back of, I put up a Q&A on Instagram asking for podcast episodes, and people are obviously struggling with this a bit because it popped up a couple of times on it. So I said I better do something about it, or put up to a podcast to give people a better understanding of what they can do for it. So to jump right into it, what is golfer's elbow, or what is the difference between golfer's elbow and tennis elbow? So golfer's elbow is basically it's medial epicondyle tendinopathy or tendinitis. Okay, so what's that mean? It's where you get pain and swelling around the medial, which is the inside aspect of your elbow. Okay, and it's right up, or very, very close to the elbow bone, I guess is what a lot of people would look at it. It's a medial epicondyle is what it's called. It's the kind of bony part up at the top of your elbow. But to not get into too much detail on it, I'm sure the majority of people that have this issue will know what it is, because they'll have done a bit of research on it. So I guess the difference between golfers and tennis is golfer's elbow is usually on the inside, and it's the flexor muscles of the wrist, and then, or of the wrist and hand, and then tennis elbow is on the outside. And why do they happen? Well, in general, tennis elbow usually occurs after people increase the amount of backhand swinging that they're doing, and where they're extending their wrist repeatedly, and that causes the extensors on the outside to flare up and give you trouble. While golfer's elbow, the reason it's called golfer's elbow, is obviously to do with the wrist gripping, pronating, and then throughout your swing. A lot that medial epicondyle is where a lot of the muscles insert, gets overused and then can start to kick up. But it's generally associated with gripping. Okay, so you can also see it with work or in occupations that require a lot of gripping, and wrist flexion, like waiters, carpenters, plumbers, plasterers. But when you're looking at sports, you're looking at like baseball, weightlifting, golf, jiu-jitsu, exercises like that, where you are obviously repeatedly gripping things. Okay, now it can also happen, this is the other thing, if you're thinking why do you have it, it can also happen as a traumatic tendinopathy, where you get a hit to it, a reactive tendinopathy I should say, where you have a trauma to the tendon or the insertion, where you just get a bang into it and that causes a reaction in the body. It starts to flare up, and these things, I should say, are more common in smokers as well. So difference between golfers and tennis: golfers is on the inside and is usually to do with gripping, while tennis elbow is on the outside of your elbow. I guess more towards the I use the anatomical term, which is the lateral aspect, but if you have your hands down by your side and your palms facing forward, that's what I mean. The outside aspect of your elbow is where you're going to get tennis elbow. Now, what is it like? Why does it happen? Well, what it's like is you're going to get pain, and you're going to notice it, especially with gripping. And you have different stages. You'll have it like that. You'll get pain before exercise, and it'll go away when you warm up, and that's stage one. And then you'll have it before, and then at the end, and then you'll have it before, during, and after, and then you'll have it just pain all of the time with any movement. And with that, then that's obviously the final stage. You would hope that you don't let it get to that stage. As with any overuse injury or any tendinopathy, you want to take care of it as early as possible and don't let it get very bad. But in general, it's going to be sore to touch. And at times, depending on the sensitivity level of your body and how it reacts to it, you can get it into your wrist and fingers when it gets very severe at times. And as I said, it only really occurs with repeated movement or repeated trauma to the tendon, where it's overused and it's not getting a chance to recover. And that's the majority of these tendinopathies, is that it's microtrauma, repeated microtrauma with inadequate recovery that causes them. So I guess to look at it, why does it happen? As I said, it's an increase in activity and a reduction in recovery. But really what that can mean is that you could increase the amount of sport that you're doing, the amount of training that you're doing, but then, or it might not even be a huge increase in that, and it might be that your recovery just is very, very poor, so that your sleep is affected, you're not getting enough sleep at night. It could also be that you're just dehydrated, you're not drinking enough water, your stress is extremely high, so you're just not getting a chance to recover properly, and the quality of your sleep is bad. And there's a lot more when these tendinopathies kick up to do with all the other factors, as opposed to just an increase in physical load. That can be a trigger for it a lot of the time, but it's the other factors that will cause it to stick around, because a tendinopathy isn't something that you usually get overnight. And as I said, that you can get a traumatic one, a reactive one, where you get a bang into it. Obviously that can happen overnight. But in general, what I mean is that it's going to be over time that these things build up. If you dog it one day and then you give it a couple of days to recover, it usually will be okay. But if you dog it one day and then you do that the next day and the next day and the next day and the next day, then these things will start to creep in. So when you're looking at what you can actually do to improve it, what I would say is, as with anything, you need to first become aware of what is causing it. And it might be a few different things. As I said, it could be that you're occupationally that you're working as a plasterer or a waiter, or it could be that you are a carpenter and, as I said, a plumber, and any type of physical job like that. And then on the weeknights, so let's say you're doing that during the weekday or the weekends, you're playing a bit more golf, or it could be that you're training jiu-jitsu, or you're doing a lot of throwing, like baseball, anything like that, or even if you're hurling, something like that, that would cause it to flare up that bit more. Because what it is, as I said, it's an increase in a couple of things usually that causes these things to flare up. So you need to become aware of what's causing it. And then you also need to become aware of, well, is my sleep, has it dropped off for the last 3 weeks or 4 weeks? And now, even though you don't notice it, but it's just creeping up it's creeping up over time, that the other things haven't changed massively, but your sleep has dropped down to 5 hours a night because of, let's say you're studying for something, you're preparing for a presentation, there's something going on in the background that you're not aware of as affecting your sleep. Let's say some type of a stressor, could be relationship issues, financial issues, whatever it is. These things were going to have a huge impact on it as well. And I always, when I say this to people, you need to, if you don't look at these other factors, especially when it comes to a tendinopathy, if you don't look at them, it's very difficult to make change, in that you can do all the exercises in the world. You can have an extremely good rehab and strength plan. But if you're not taking a holistic approach and you're not taking the time to let it recover after you stress it, well, it doesn't make a difference what you do, because it's never going to get that much better, because you're just stressing it and you're not letting it recover, which is the issue of what's been happening all along. So you need to get everything else in line. You need to make sure that you're drinking an adequate amount of water, that you're enjoying different activities throughout your day. Then outside of that, you also need to look at maybe reducing the activities that are aggravating it. So you might have to take a couple of days off training, or you might have to just reduce the amount of training that you're doing. By doing that, then you can give it a chance to recover a bit more. At the start of a tendinopathy, a lot of the time it's you want to stimulate it and then give it a couple or a small bit more recovery time. And as it gets through the end of your rehab stage, a lot of the time your training load is increasing, your recovery time is decreasing, and you're trying to make it tolerate the load, or help it to tolerate the load that you're putting on it again. So outside of that then, what I would say is you want to avoid complete rest, because stopping completely can be as bad for tendons as doing too much, because once you get back at it again, they will start to flare up again. So we need to avoid complete rest and just make sure that you're reducing the activities and then progressing back into them again. What do you do as you're progressing into them? What I would say is focus on basic movements first, okay? And think of it holistically. So nothing really works in isolation. So like if it is, a lot of the time when you move your fingers and you've golfer's elbow and you start gripping and you move your hand, that will cause you to have a bit more pain. That can cause it to kick up. But just doing it on a very basic sense of what you can, like practicing gripping things lightly, or just getting your fingers moving and getting your wrist moving around in circles, getting the hand moving that bit more, can just help to, I guess, take away some of the inflammation that's there already, promote a bit more healing, promote circulation to the area without overstressing it. Okay, and it's an easy thing that you can do on a day-to-day just to help take pain levels down and help promote recovery. So I would always say, look at the basic exercises you can do first. Then I'd start to look and work up along the chain. Obviously, you have your wrist and fingers. You obviously need to get the elbow moving as well, okay? Because it could be that you're just moving your hands a lot and you're not getting your elbows moving properly and not extending and flexing your elbows enough. And then you need to look up further along the chain. So look at your shoulder, your thoracic spine, and your neck as well. Okay, when you start to take that more holistic approach to it, then you'll find that there might be other kinks that may not be the main issue, but could be contributing to your lack of movement there. So it's just important to make sure that you are ticking off all the boxes when you're doing it. And the last thing you want is to fix something and then something else to flare up. So it's important to take the time to go through it, go through your exercises, go through your basic movements, and then slowly progress into your strengthening work. Okay. Now, with strengthening work, you need to be a small bit more cautious at the start, because there's obviously different types of exercise you can do. You can do isometric, you can do eccentric, you can do concentric, and a basic, I guess, overview is an isometric exercise is when you're holding, and when the muscle is contracted and you're just holding, and this can be excellent for tendinopathy to take down pain. And really, I'd be always looking at introducing these early on. Then eccentric exercise can be excellent as well, because it builds a good bit of strength, obviously eccentric strength, and it can be a lot more, or you can do it with a lot less pain. You can go through eccentric exercise with a lot less pain, and in some situations, as I said, this could be the cause of it. So a lot of the time the potion is in the poison, in that you just have to do a small bit of the aggravating activity at times to improve it. Just a little disclaimer: make sure that you go to your medical professional or healthcare professional to talk through what you can do first, because you don't want to just be picking up things that I'm saying here and just trying them out yourself. But I'm just trying to give you a better idea of what you can be doing first, and then I would be looking at doing general shoulder movements, general wrist and arm movements, but I guess compound movements is the word I'm looking for, as opposed to general compound exercises like your deadlift, like an RDL, a pendulum row, all these exercises that are going to cause you to grip and bring those muscles through their range, but in a controlled fashion as well. Pull-ups are a good one that can't be underestimated when it comes to gym and when it comes to strengthening. And a big one that I always include in any upper limb or lower limb program is carrying. And I think it's definitely left out in a lot of programs, and it can fix a lot of issues. So our farmers carries, or suitcase carries are excellent. You can also look at other things like searcher carries, but farmers carries, where you're gripping a weight and you have to walk for 30 to 45 seconds, is such a good way of testing strength and helping muscles to coordinate better, and just improving overall shoulder health and just physical health in general, because it's something that we lack a lot of. And every time you grip something, your body has to stabilize, for lack of a better word, in that when you grip something, your elbow has to stabilize your shoulder, the rotator cuff muscles in your shoulder and your scapula have to stabilize, and then that obviously has to go to your midline where your spine is, and then down to your feet so you're not just falling over. So gripping and carrying stuff is a great way of, and it's an isometric as well, that's the thing. It's a great way, or a great start for something like this at a level that you can tolerate, obviously, and then progressing over time. You're also looking then at overhead presses, bench presses, pulling exercises, any type of pronation and supination exercise, and that's just basically turning your palm up and down. That's pronation is when your palm is down, supination is your palm is up, and working through those. Now, you might be using some type of resistance band for that. You could be, what I say to people sometimes is like, to build up the strength of your hands, you can go into a push-up position, come up on your fingertips, and work in that position. But as I said, like, you don't want to just load up a load of aggravating activities and then make it worse. So it is important to understand what you're doing and kind of have a plan in place, where you're trying to get to. That's really where it's at. It's having that plan that you can be consistent to. It makes a big difference. Now, with that, I would also finish off, because I won't go too much more on this podcast. I kind of wanted to make a short and snappy one for the people who struggle with it. So with that, I would say that you need to focus, I'm going to come back to it again, on recovery as much as training at the start of these things, and make sure that you're taking care of all the other aspects before you start adding in all those strengthening, all that strength work, because it's not going to add anything to you. It's only going to take away. It's only going to add more stress is all it's really going to add, which isn't what you need. You don't need loads of extra stress on a body that's not getting enough recovery. That causes degeneration and breakdown. So focus on that recovery side of things first. Get your sleep right, get your hydration right, your diet and your stress management right, and as well as your general movement, and then look at all the other things that you can do. And as always, if you're struggling with something long term, you can definitely get onto me. I would say get onto a medical and healthcare professional, which fortunately I am. But just Australian. But if you want to, guys, reach out to me on Instagram, send me an email, whatever you want to do, or whatever way it works best for you, and we can chat about it in more detail if you'd like. I can tell you what to do, or at least give you a bit more advice. We can jump on a call, and if it's something that you want to take a bit further, then we can map out a bit of a plan about what you can do to get it right, and we can set that up. So if you are interested in that, let me know sooner rather than later, I would say, because as I get into the new year, things will be changing, and then with that, obviously, the coaching that I'm doing at the moment, I can only take on a certain amount of clients, so at any one time, because I'm not just able to load up and take on 200 clients, unfortunately, because of the time that it takes to make it, or to make up plans and do all that. So if it's something you're interested in, send me a message and I will do my best to fit you in, if that's something that you want to go forward with. But on the offside, or on the other side, I'll still give you some advice on what you can work on to improve it. But that's everything from me today, guys. I'd love if you know anyone who's struggling with this issue, please send it on. If they're struggling with a tendinopathy at all, whether it's anywhere in the body, send this on to them, because it'll give them a better understanding of what they need to work on, because a lot of that was general principles. And yeah, if they have a rotator cuff issue as well, that can be applied to this also. So definitely send that to any family or friends who are struggling with it. I would also love if you would be able to please to rate this on iTunes, and just leave a short comment, whatever it is. It doesn't have to be anything too in depth, but it goes a long way in helping me rate the podcast. It goes a long way in helping me understand what episodes you like and what ones you don't like, or what ones you'd like to see more of even. And through that, then I can always look to get on better guests that can talk about different topics in a lot more detail. And then on Spotify, subscribe, YouTube, subscribe as well. My Instagram is The Mobility Tutor, just in case anyone doesn't know. And you can also send me any messages that you would like on that. But that's everything from me today, guys. And I hope everyone is doing well. And I'll chat to you all again soon at the same time next week. Have a good one.